Imagine you take every pill you swallow in a day, tip the bottles over a bowl, and listen to the sound as they hit the glass. 1, 2, 3, 4, 5, 6. If your bowl would be crowded or overflowing, stay with me. Every pill in that bowl was added for a reason, but when you stack them together, they can quietly become one of the biggest threats to your balance, your memory, and your independence. Doctors call this polypharmacy, usually defined as taking 5 or more medications every day. For adults over 60, that is now the norm, not the exception. Research shows that the more medicines you take, the higher your risk of side effects, falls, confusion, and hospital stays. Every medication has risks, and when you combine many, those risks add up. This video is not anti-medicine, and it is not personal medical advice. Never stop a prescribed drug suddenly without talking to your clinician. My goal today is to give you 7 smart questions to ask before anyone adds one more pill to your list. You can write them on a card and bring it to every appointment, so you and your healthcare team decide together what truly belongs in your body. Question 1. What is this pill for, exactly? And which problem is it supposed to solve for me? If your doctor says it is for your heart or it is for your nerves, you can gently ask for more detail. Is it lowering blood pressure, treating an irregular rhythm, easing nerve pain, helping sleep? When you know the precise purpose, you can judge whether it helps, and you can also spot duplicates that do the same thing. Question 2. Is this pill absolutely necessary right now, or is there a non-pill option we have not tried? Sometimes medication is life-saving and not optional. Many other times, lifestyle changes, movement, physical therapy, stress management, or nutrition can reduce the need for a new prescription. You might say, before we add this, are there changes I could try first? That one question can open a very different conversation. Question 3. How does this new pill interact with everything else I already take, including over-the-counter medicines and supplements? Dangerous drug interactions are a major reason older adults end up in emergency departments. Yet many people forget to mention the sleeping tablet from the supermarket or the herbal capsules from a friend. Your doctor or pharmacist cannot protect you from what they do not know. Bring every bottle to your appointment in a bag, or keep an up-to-date written list and ask directly, are there any serious interactions or duplicate drugs here? Question 4. Is this dose right for my age, kidneys, and liver? As we grow older, our kidneys and liver clear medicines more slowly, and our brains become more sensitive to drugs that cause drowsiness or unsteadiness. A dose that was perfect for you at 40 can be far too strong at 75. For many medications, older adults should start with a lower dose and go up carefully only if needed. That is not being difficult. That is protecting the only body you have. Question 5. Are we treating the original problem, or are we treating a side effect from another medication? Pill number 1 causes stomach upset, so pill number 2 is added for heartburn. Pill number 2 causes constipation, so pill number 3 is added for that. Suddenly, you're on 3 or 4 drugs, but the original problem is still there. When you ask, could this symptom be a side effect of something I already take? You open the door to deprescribing, which means safely reducing or stopping medicines that no longer help. Question 6. How long should I take this, and when will we review my entire medication list? Many prescriptions begin in a hospital or during a crisis and never get revisited. Before you add a new drug, ask for a time frame. Is this a short course, a 3-month experiment, or a long-term treatment? Then ask, can we schedule a full medication review at least once a year so that every item in your pill organizer has to justify its place? Question 7. If the side effects or the cost of this pill become too much for me, what is our plan for stopping it or switching to something safer for older adults? Many medications need to be reduced slowly, not stopped overnight, to avoid withdrawal or rebound symptoms. Others can be switched to safer options for older adults. When you agree in advance on how you would step down, what warning signs to watch for, and when to call for help, you are far less likely to stay on a drug that makes you miserable simply because you fear what will happen if you speak up. Now take a breath and picture that bowl of pills again. Imagine looking at each one and knowing exactly why you take it, how it helps you live the life you want, and what the plan is if that ever changes. The goal is not a zero-pill life. The goal is a clear, intentional medication list that serves you, not the other way around. If you're over 60, here's your homework before you swallow your next dose. First, write these 7 questions on a card and keep it in your wallet. Second, gather every pill bottle, every supplement, every over-the-counter medicine, and bring them to your next appointment. Ask for a proper medication review. Third, share this video with one friend or family member who you know has a very full pill organizer, and tell them you deserve answers too. Your medicines are powerful tools, but they are not the boss of you. You are allowed to ask questions, to understand, and to say, I want to know if there is a safer way. If you found this helpful, subscribe for more science-based videos on staying healthy, strong, and sharp after 60.